friends, today we are discussing about the Siddha system of medicine. Siddha system of medicine is, I would say, like a relative of Ayurveda because many of the concepts of Siddha and Ayurveda are similar because they generated in same time in India. However, in North India, the concept was a bit different. Also, in South India, the concept was a bit different. In Southern India, more stress was given to meditation and the use of bhasmas compared to North India, where the organic substances were used for the treatments. So, the person who mainly gave this Siddha system of medicine to Southern India is Agastha. He has originated the Tamil language as well as also converted much of the knowledge which he had related to treatments, and he had complied the Siddha system of medicine. So here again it is very much similar to Ayurveda as I said, and here we have two essential entities. One is the matter and another one is the energy. In Sanskrit, it is known as the Shiva and Shakti. Matter is related to Shiva, means God Shiva, and energy is related to the goddess Shakti. So, generally, Shiva is the male part and Shakti is the female part, and they are also correlated to the creation. They are the primordial element, that is basically there are bhutas. That bhutas are nothing but what the pancha tattvas in our Ayurveda. Like we have moon, which is solid, we have Ni, which is fluid, Thi, which is radiance, Vayu, which is gas, and Akasam, which means the ether. This is exactly same to the Ayurveda. Again, the concept of Vata, Pitta, and Kapha. Here it is termed as Vatam, Pittam, and Karpam in case of Siddha system of medicine. So basically, the three dosham, they are balanced between Vatam, Pittam, and Karpam. And each and every cell of the body, these three doshas, they exist and function harmoniously. First is the Vatam, is formed by Akasam and Vayu. It controls the nervous action such as movement, sensation, etc. And Pitam is formed by Thi and controls the metabolic activity of the body, digestion, assimilation, warmth, etc. And Karpam, it is formed by Moon and Neer and controls the stability. So, the three doshams are involved in all functions of the body like physical, mental, and emotional. First is Vatam. It is characterized by dryness, lightness, coldness, motility. It is formed by Akasam and Vayu, controls the nervous action, including the movement, activity, sensation. And Pitham is the heat mover of the nervous force of body, formed by Thi, controls the metabolic activity, digestion, warmth, intellect, assimilation, etc. And the Karpam, it's characterized by smoothness, firmness, viscidity, heaviness, formed by Moon and Need, controls the stability of the body. Now, as per Siddha system, again we have the Sapta Dhatus or seven Dhatus. Here the names are slightly different, like Rasa, which is lymph, Kurudhi is blood, Tasai means muscle, Kojukku means adipose tissue, Elumbu leads to bone, Majjai means bone marrow, Sukillam and Artavam means male and female hormones which are produced. So these are seven dhatus or material which are produced in the Siddha system of medicine. So the method of treatment is by substituting a drug of the same constituents guna, the equilibrium is restored. So, as it is similar to Ayurveda, when the balance in Vatam, Pitam, and Karfam is there, when there is any disbalance, so that balance is brought back by giving a drug of opposite nature. So, the correction of the imbalance is made by substituting the drug which is predominantly of the opposite nature. An example of Vatam imbalance is cold dry. If the person is having a cold dry nature and he is suffering from a disbalance in vatam, then what will be the treatment? It will be that we have to give any kind of oily and warm producing substances. So generally what is said that there should be a massage if there is any inactive of the limbs due to the cold and dry nature. So it is massage using warm oil, so that will help in the treatment. In method of treatment, basically five types of vayus are followed. First is prana, which is located in mouth and nostrils, inhaled and helps in ingestion. Apana, located at the anal extremity, helps in elimination, expulsion. Samana, that is equalizer, helps in digestion process. Vena, this is circulation of blood and nutrients. Udana, which helps in upper respiratory passages. Now, if we talk about Siddha pharmacy. So, this Siddha system of medicine here uses many of the metals or heavy metals for the treatment. As I told you in Ayurveda, generally organic substances are preferred. However, many inorganic substances are added, but in Siddha system of medicine. Generally, majority of medicines are of inorganic in nature, and in that one of the most used ingredient is basically mercury. So, mercury, as we all know, it is considered to be a very poisonous ingredient, but it is one of the important ingredient in Ayurveda as well as Siddha system. Mercury occupies a very high place in Siddha medicine. It is used as a catalytic agent in many of its medicines. The addition of sulfur is to control the fluidity of mercury. This converts to mercuric sulfide, which is insoluble in mineral acids. So, these are the five different ways in which mercury can be prescribed or administered to the patients who are followed Siddha system. First is mercury metal is the rasam, red sulfide of mercury, which is known as lingam, mercury chloride, which is also known as viram, mercury subchloride or mercury chloride, which is known as puram, red oxide of mercury. This is rasa chinduram. However, I would say that whenever we are using this mineral, these heavy metals, they are used to be very much restricted and monitored, because in case we do not follow the exact procedure mentioned in the traditional text for formulating these products, then we are actually poisoning the person. If we look at the classification of Siddha medicine, so one is Uppu, this is Lavanam, where drugs that dissolve in water and decrepitated when put into fire, giving off vapor. Second one is the Pasanam, where drugs that do not dissolve in water but give off vapor when put into fire. Then is the Uparasham, where drugs that do not dissolve in water, such as mica, magnetic, iron, antimony, zinc sulfate, ferrous sulfate, etc. Fourth is the Loham, where the metals and mineral alloys such as gold, silver, copper, iron, tin, and lead. Rasam, where the drugs that are soluble such as mercury, amalgams, and compounds of mercury, arsenic, etc. Sixth one is the Gandhakam, where sulfur insoluble in water burns off when put into fire. Seventh is the Ratnas and Uparatnas, where 13 varieties are described, such as coral, lapis lazuli, pulse, diamond, emerald, ruby, sapphire, etc. So, the Siddha pharmacy, it formulates the formulation into different types of dosage forms. For example, First one is the Bhasma. This is calcinated metals and minerals. Second is the Churna. This is the powder. Third is the Kashaya. This is decoctions. Fourth is the Leho. This is confection. Grita, which means ghee preparation, and Talia, which means oil preparation. Churna, this is a very important formulation in Siddha system of medicine, which means metallic preparation which become alkaline. Seventh is the Mejugu. This is waxy preparation. And last one is the Kattu. This is the preparation that are impervious to water and flame.